Happy Friday, everybody. Welcome to everybody's favorite show about plastic surgery, health, and beauty. This is Nip Talk. Today we got some really interesting topics. First off, Megan Fox breaks the internet with a photo from her from a Super Bowl after party, spawning plastic surgery rumors. But is it fair? We're going to discuss. Then, Sharon Stone in the interview says that she's glad her plastic surgeon is dead. What could have happened? We're going to talk about that. And finally, 2023's biggest medical breakthrough. There's some crazy stuff. We're going to unpack it, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle. With your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. It really helps us. I'm your host, plastic surgeon Dr. Bruce Hermann. With me, as always, is the wonderful Sarah. Hi, Sarah.
Hi.
Travis, in the box, you there, buddy?
I am.
Wouldn't be the same without you.
I am. Happy Friday.
Happy Friday. Yeah. It's always a good day when we're on the show because that means it's Friday.
Absolutely.
Now, Travis, you know I'm going to ask, how did your speed dating thing go last weekend?
So the speed dating went fine. I actually went speed dating and I had like dates lined up.
Oh, that's right. It was both.
Yeah, it was two different things.
Anything interesting or?
So the dates, like the 5 dates didn't happen. It was 2 dates. Yeah, it was 2 dates, and then I chose between one girl, and I ended up choosing one of the girls.
Oh, you did?
Yes.
So is this thing maybe something that could turn into something, or not sure yet? Too early?
Yeah, it's too early to tell.
Too early.
You just never know.
That's exciting.
Now, they set up the dates for you, right? Like
they did.
So anything interesting that you guys went and did, or was it just kind of run-of-the-mill, grab a drink or
so
dinner?
We went to Trinity Groves is what it is.
I've heard of that.
Yeah, it's Trinity Groves out in West Dallas. It's a spot called Some Dang Good Chinese Food.
Oh.
It's like a Chinese spot out in Trinity Groves. And then
nice.
we like hit the beer garden. That's like they
Oh,
have
yeah.
out there. Yeah.
Chinese food and beer garden? Sounds like a perfect date to me.
It was a cool time. It was a cool experience. I've never done anything like that.
Man, that's really awesome.
Absolutely.
Fun.
Now, let's see. Was the Super Bowl last weekekend or was it?
Yeah.
Oh, okay. I assume you guys watched Super Bowl?
Yeah.
Yeah, I watched
good.
it. Mm-hmm.
It was pretty good, man. It came down to the wire. I was the only one that was rooting for San Francisco between the three of us, right?
Yeah, I think so.
Yeah. Oh well. I mean, all of my teams break my heart, but I should have known that KC was going to win.
It's okay.
But yeah, it was a good game, and
Yeah,
pretty exciting. I was trying to remember if there's any good commercials. I was kind of in and out on watching.
this Michael Cera did a funny commercial with CeraVe lotion.
Oh, right. And then there was the one that, was it Kanye that did one where it was like him taking a selfie?
Yeah, he was doing like it was literally a Snapchat video, and he
Right.
made it into a commercial.
And I heard...
He said it was so expensive that he couldn't afford to do anything else except for
the
Snapchat.
But I heard that he sold like 2 or 3 times the value of that. Like he sold like $20 million in merchandise after that commercial ran. I read that.
Yeah.
That's pretty wild, man.
I've read the same thing. I don't know if it's true, but I've read the same thing.
Yeah, that he made a lot of that. And then just along those lines, then there was that Mark Zuckerberg taking the selfie, like when he was talking about that augmented reality thing.
Yeah.
That's kind of a new thing where people are doing these, I guess, really big kind of ad campaigns where it's like, hey, what's up, guys?
Yeah.
Just holding a selfie.
Absolutely.
It's kind of cool and interesting, honestly. But, well, anyway, all right. Well, speaking of Super Bowl, I have a segment related to the Super Bowl.
Yeah.
Which I know you heard about, Sarah.
Yeah, I saw it.
Did you hear about this, Travis, with Megan Fox?
I did kind of like.
Do you guys remember her? Like, I mean,
No.
I remember her from the Transformers movie because she like came out of nowhere and was.
I grew up watching her in like little teeny bopper movies.
Oh right, because she was in some stuff before that.
Like, she was all over it.
Well, Megan Fox kind of broke the internet because of a picture that they took of her at a Super Bowl party.
Yeah.
And it spawned all this talk about, had she had plastic surgery, and then the same old conversation of, our actresses, changing their appearance. And
I feel like we've talked about her before.
I don't think we've talked about Megan Fox, have we?
No, not that I can remember.
I don't remember.
I don't know.
I probably remember because I really do I had like the hugest crush on her when I was like younger. I thought she was just the most beautiful.
She is really pretty.
Yeah,
but she's definitely had some type of stuff.
So I want to throw up the picture that broke the internet and social media. So toss this one up. Yeah. So when I saw that, I was like pretty shocked at first. I was like, it doesn't look like Megan Fox. And I can understand why this picture did drum up, some conversation and some questions of like, what has she done? But she came back on social media and kind of
posted another picture.
Yeah, she clapped back and said, "Look, this is just bad lighting, and it's the way I'm, making this."
Her little kissy face.
Yeah, the kissy face. So there was actually a picture just later, and I want to throw it up because she is kind of absolutely right that because of the lighting and because of the way that she, was doing her face with her lips and stuff, it made that picture look way worse, or maybe way different or exaggerated than she normally does. But I mean, I do think that if you look at that picture of her, either one of those two that we just posted compared to pictures in the past, I mean, she does look a lot different.
Yeah. And
so, it brings up the question of, well, one, has she gone too far with this, or, two, what has she done? So I want to throw up a picture from her. I think this one is from 07 or 09. Yeah, so that's the Megan Fox that I kind of remember. I mean, honestly, she kind of looks like the girl next door, really. I mean, she's obviously a very beautiful woman, but, just looks, not, she doesn't look like she's had anything done there.
No.
And so, so when you compare it to the other one, I can't remember which one I put up. I think it was actually the bad one. Yeah, it was the bad one. It probably wasn't fair to do that. But, so looking at that, I mean, I think that we probably would all agree it looks like she's augmented her lips at least a little bit.
Yeah.
I mean, I think the way that she's posing is not necessarily.
Yeah, I don't think that helps. But honestly, I think she still looks really great. I follow her on Instagram, so it's like I've seen her talk about how she feels about herself, and she's come out and said like she's struggled with her appearance for so long, and I think it's because she's always been this like sex object, like this girl that's supposed to be like every guy's dream kind of thing, and she's like, I can't even keep up with the young.
She can't live up to the hype, I guess.
Yeah, so she says she's always struggled with it.
Wow, that's just crazy and sad too. I mean, because I do think she's and was one of the most beautiful actresses.
She just looks very like smooth, like her face just doesn't have any type of like she just doesn't look like
no curves or contour to it.
Yeah, like
she does look thinner.
Very like I don't know.
I think there is 2 surgeries she had done when I was looking at her photos, and I'm not dogging people for having surgery, obviously, because that's like my whole business.
I think she looks great, but
I mean, she does look really good, but to me, she looks very different to the point that if someone had thrown up maybe that second picture, not the one that kind of looks bad because of the light and the way she's making her face, but I'm not sure I would have recognized her because I just did follow her on Instagram because of this, but I hadn't been following her, so I hadn't seen any recent pics. But comparing her like 07 to current picture, there's 2 things that I saw like surgery-wise that I feel pretty confident about. One is I think she had her nose done. It looks a lot thinner to me. Now, you can get that look with contouring makeup. We've discussed that before, but I kind of zoomed in on it. I was like, yeah, it looks like she's probably had her nose, her halo, which is the kind of the curved part of the nose, to me looks a little bit different. And also like just the root of her nose looks a little thinner, which is fine. I mean, if people want to get a nose job, get a nose job. I mean, I'm not at all dogging her for doing it. I personally thought her nose looked fine.
For sure.
But it's not up to me. I mean, a lot of times people come in, I think people look good, but they want to change something a little bit. And I'm like, yeah, as long as it's reasonable, I don't have a problem with it. But I do think she probably had a nose job. And then the other thing, surgery-wise, throw up that next picture, Travis. So I think without question she had a breast augmentation, which I think she's had some kids. And so, super common after women have kids to get an augmentation to kind of fill things back out. But yeah, I mean, natural breasts don't sit the way that picture on the right does. That's just that's not natural, which is fine. I mean, a lot of people get augmentations that look like augmentations. So once again, I'm not trying to beat up Megan Fox whatsoever, because I do really like her as an actress. But yeah, I mean, I do think she has changed her look a lot, and I wouldn't necessarily dog her for that either. I mean, she's kind of going for this rock girl look. I mean, she's in her fiance Machine Gun Kelly.
Yeah.
I mean, the rapper. I mean, so she's like in this whole rock and roll lifestyle, and you know, she's looking the part. I mean, you know, it's different than what maybe we were used to, and you know, you were seeing her on the whatever shows it was that she was on. What show? Do you remember what shows she was on?
She was on like.
I know that she was on.
It was called like Teenage Drama Queen or something. With
Life
Lindsay
of a
Lohan.
Teenage Drama Queen or something.
Yeah, like she always played like a B word. Always, because she's just
right, because she has that look, right? I totally
She's
get
got dark hair and like those like eyes,
like the mean girl.
So she always plays like this kind of like, just a mean girl. And she was in New Girl for a while. That show New Girl that was on Fox.
I didn't see that one.
Yeah.
She's been in a lot of stuff. When I was kind of doing research for this, like, oh wow, she has done a lot of things since Transformers, which is what I always remember her for. But yeah, and then other stuff. I mean, I think she probably did her lips. In that second picture, they don't look too bad. Can you throw up that Travis, the one, not the one where the light's all bad, but the second one of her? Yeah. I mean, honestly, I think her lips look pretty good there. You know, I do think she probably had some filler, but I don't think it's a bad job. And to me, her cheeks don't look too full. I mean, to me, her face looks a little thin. I mean, she probably just has, you know, lost weight or, you know, been exercising.
No, yeah, she's definitely more toned.
Yeah, definitely. She's definitely thinned down, like, her body fat percentage.
I can always tell now from looking at pictures with you. I can always tell when girls get something done, or like anybody gets something done.
Yeah, look at you, expert.
Like
High five.
I was watching the show Tacoma FD Fire Department. It's on like, it's like a funny show. It's about firefighters. The guys that made that funny
Reno
cop
911.
show. Yeah. And the girl that's on there, you could like I noticed like I saw like filler and Botox.
Instantly, you're like listing
like
off.
after like after a season was finished and the new season started,
yes,
and I could see. And I found out that she's on Yellowstone too.
Oh, who is she on Yellowstone?
I don't know. She's a blonde girl. She's really pretty. But
wait,
like,
she's like 40. Okay, I was wondering if she was like the daughter character in Yellowstone.
No, that's not her.
That's not her. Okay, yeah.
But yeah, I think
But you saw it
she
instantly.
plays one of those like buckle bunnies, is what they call it.
Oh, right.
Yeah.
What about you, Travis? Do your friends now rely on you to be the expert plastic surgery person in your group?
Not so much.
Not yet? Okay.
Not so much. But I do be on the lookout for it more now.
Are you?
I definitely be on the lookout for it.
Cool. Well, I'm glad that this is like, you know, it's kind of branched out, you guys, and new expertise that you could share with the world.
Absolutely.
But no, I think Megan Fox, I think to your point, she looks amazing. She looks different. To me, she doesn't look like she used to, but hey, you know what? If you want to change your look and your appearance, go for it. I don't think any of her work is bad. I mean, that picture was bad, but I mean, who hasn't taken a bad picture? It's
I mean,
just
if anybody goes like this, it's going to look like you have like.
Yeah, it looks like, at first I was like, oh my God, she had a buccal fat removal. I'm like, no. And then I saw the next picture and I was like, no, she didn't. But so anyway, I mean, she's had some work done, obviously, but I think it's good work. I mean, I'm not going to dog her at all. I think all of the hate that she caught is just, you know how the internet is. You know, they just love to dogpile people for things. And so you go, Megan Fox. I think you look great.
Yeah,
so,
seriously.
All right. Well, let me know. What do you think about Megan Fox? Leave us a comment. Did she do too much? Does she look as good now as she did when she was in Transformers? I don't know. I think she does, just different. So yeah, I'm gonna say that all that hate was unwarranted.
Bored people.
Yeah, bored people on the internet. Yeah. All right, let's move on to the next segment. Talking about hate, man, I saw the title of this article that popped up in one of my feeds. I was like, oh my gosh. I
hadn't heard about this.
I have to hear about this one. So this comes from, you guys remember Sharon Stone? Sorry, I blanked on her name for a minute.
Mm-hmm. That's Ozzy Osbourne's, is that her?
No, that's Sharon Osbourne.
Okay.
Sharon Stone was very, very, very famous in, when was it, the 90s? I think it was the 90s for a movie called Basic Instinct. Mm-hmm. Do you guys remember that?
I don't remember the movie, but I remember that part.
Are we going to see a picture
of her,
the
part. Yeah, so, well, I just have a picture of her recently. She's 65 now, I think. So she was in this movie called Basic Instinct, and a lot of people I'm sure know what I'm going to talk about. So there was this scene. So she was kind of like a bad person in the movie. She was murdering people, and she was seducing them and killing them. It was a very sexual movie. And there's a scene where she's being questioned by the police, and she has her like legs crossed, and she's like in this little crop dress. and then she like uncrosses her legs like this, and she didn't have any underwear on. And that scene was in the movie, which at the time was, you know, kind of a big deal for a rated R movie to have something like that. And it spawned all of these, I mean, at the time they weren't called memes, but, you know, all of these internet, you know, people talking about it. So that, I don't know, maybe I'm sure she's more famous for other things, but that's how I always remember it from the 90s, because she was well known for that.
I feel like if I saw a picture of her from...
She looked actually very similar to her picture that we just showed, except obviously she was, you know, 30 years younger.
Yeah. I don't know why I can't like place her.
Yeah, she had short blonde hair, just, you know, very toned, very attractive. The movie was pretty good. It was just, you know, it was kind of racy for the time.
Yeah.
Anyway, enough digressing about Basic Instinct. So I saw an article with Sharon Stone in it. She went into an interview, and she was in the news talking about this plastic surgery nightmare, and she said that she was really glad that her plastic surgeon was now dead.
It's pretty serious.
I was like, whoa, I was like, what could have possibly happened where you would wish death on someone?
It's really
and
weird.
So I looked it up, and there was a little bit of information about it, about what happened. She talked a little bit about it, but I couldn't like find like who was the plastic surgeon or any, you know, good details, because this actually happened in 2001. So in 2001, so I guess she was 40, 43 at the time. She was found to have some large benign tumors in her breast.
Yeah.
And so at some point, someone recommended that she have these removed, which, playing armchair quarterback, I mean, I'm not sure that was probably a good idea. I was trying to think what she may have had, and I think it is interesting to talk about, speculating, because it didn't say what it was. It just said benign tumors. So, one of the most common benign tumors of the breast is fibroadenoma, which is just a benign growth in the breast. But the thing is they tend to be pretty singular, and they don't tend to be bilateral.
Okay.
And she had both breasts basically removed for these. So although fibroadenoma is really common, I don't think that was it. It could have been just cystic breast disease. I don't know if you guys are familiar. I mean, there are women who get this very dense cystic breast tissue, and doing what I do, I mean, I've examined a million different women breasts, and you do see it from time to time, and it can feel really, really hard. I mean, almost like unnaturally hard, and you can definitely have that on both sides, and so I think that that's definitely a possibility. There's another one called pseudoangiomatous stromal hyperplasia, which is just a big long doctor word for kind of abnormal growth of breast tissue and blood vessels.
Okay.
That tends to be single side as well, so I doubt that was it, because she did have both done. And finally, the other thing is phylloides tumor, which is it's a benign tumor that can turn into cancer. They tend to be pretty big, but they don't tend to be bilateral.
Okay.
So I think she probably either had cystic breast disease or just very dense breast tissue, and someone recommended her to have that removed. I mean, of course, I'm playing armchair quarterback, but probably was not necessarily.
The plastic surgeon that died was the one that recommended to.
No, it wasn't the one that did it. Someone else removed these things. Okay. And so after she healed from that, she went to a plastic surgeon to get reconstruction, which is very common. It's very similar to people who get mastectomies for real cancer and go on to get reconstruction. And so it didn't go into a lot of detail about exactly what went down, but the gist of it was she went and saw a surgeon, and I guess they had a plan, and then she went into surgery, and when she woke up, she found out or instantly noticed that he had put breast implants in her.
Yeah.
And that was not something that they had discussed.
Oh.
So per her, and I couldn't verify this by finding the plastic surgeon, because apparently he's dead now. He put breast implants in her without her consent. Now, if that's true, that is a colossal mistake.
Yeah.
I mean, that is not cool. In a lot of states that would be considered assault.
Yeah.
If you do a surgery on somebody they didn't consent to. So she was very, very unhappy about that.
He's like, they look better with these.
Well, that's exactly what she said. So there was a quote, and it said that and this is her talking. She said, "This is what he told me, that I did it to match your hips, and we decided it would fit your body better than whatever previous plan we discussed." And so, I guess what really happened here. Well, I mean, it's only one of two things. I mean, one, the surgeon really went rogue and put in implants without.
I thought he was doing her a favor.
Right. I mean, it's a little hard to believe someone would do that, especially. I mean, not that you would treat a celebrity any different, but someone high profile like that to make such a really, really bad decision.
Like what they say.
Right. And so the other thing that it could be, and just to play devil's advocate and be fair, is it could have been poor communication between them.
Yeah.
You know what I mean? Because and I this is one of my serious pet peeves with certain doctors, and when I was going through my training, I saw people do what I'm about to talk about, and it really bugged me. So I do the complete opposite. But there are a lot of doctors that'll come in, and so so you're the patient. Oh, Sarah, you're here for breast reconstruction. Okay, cool. So we got a couple things that we can do. You'll be down for 4 or 5 days, but it's a pretty easy surgery. All right, we'll see you next week when we do this. And there's not a lot of explanation of, okay, well, what exactly does that mean? Because the average person, if you just say you're going to do breast reconstruction on someone, the average person has no idea what that means.
Yeah, so maybe his breast reconstruction always include.
Yes, yeah, and to be fair, that's the most popular way to reconstruct breasts is to use implants. I mean, that is the most popular way, and so there is that possibility that in good faith he was doing what he said he was going to do, but he didn't explain it properly. Now, both options of what may have happened are still the surgeon's fault.
Yeah.
I mean, if it was the first one where he just totally went rogue and said, I'm going to do surgery A, but did surgery B instead, that was something completely different, not acceptable. I mean, absolutely terrible, that's malpractice and can be considered assault.
Yeah.
If it was just poor communication, I mean, still bad on him, but it's a little bit less egregious, I guess.
Yeah.
Because I guess I don't think she sued him for that.
Yeah, I'm like, did he keep practicing until he died? Did she ever get her implants removed?
I assume he didn't sue, and that kind of makes me think it was more the poor communication thing, because what may have been in his medical records is, well, patient Stone and I discussed reconstruction, which included these options.
Yeah.
Augmentation, tissue, fat grafting, or whatever. And so it was kind of listed out that maybe they did talk about it, but when actually verbally they were talking, he didn't make that clear.
Yeah.
So I think probably that's the more likely.
Yeah, I feel like that too, because it's like if you're doing plastic surgery on a famous person, it's like your work is going to be seen by a lot of people, and if you mess it up, they're going to say something.
Right. Yeah. So
if you do something like directly what they didn't want.
Yeah, if you do something the complete opposite of like what they agreed to, you're going to catch grief for that for sure.
Yeah, I could see that. It's the way you explained it.
So, with everything that we talk about, I always like to discuss if there is anything to learn from this. And I do think that there is, and I talk about this all the time, that having a good doctor-patient relationship is just critical. Mm-hmm. And that's what really bugs me when there are surgeons or other doctors that just kind of breeze through the room and it's like, oh, hey, you're going to have a breast augmentation? Cool, we'll see you next week when we do it. I mean, that's not good relationship. If the patient doesn't understand what's happening to them, in at least some detail. I mean, they don't, need to know every step of an operation, but I mean, I do go through the steps of operation with patients, say, okay, this is what I do, then I do this, then I do that.
Yeah.
So that they at least have a basic understanding of what's happening to them, go over, recoveries, instructions, and it does help. I mean, very rarely do we have patients that come out confused or feeling like that something happened. I mean, I can't really remember anyone that came out and said, well, this isn't, what you told me it was going to be.
Yeah.
And that does happen sometimes in medicine. So, if you're picking a doctor, and this doesn't necessarily have to be a plastic surgeon, it could be any doctor, find a doctor that'll spend at least a little time to talk to you, because it's better that way. I mean, I find that patients that understand things are more apt to be involved in their own care, and there's no doubt that those people have better outcomes. People who follow instructions, people that come to their follow-ups, like they're going to do better than people that just do whatever they want.
Yeah, I think that applies in like every part of medicine for sure.
And I do think it's the doctor's responsibility. Ultimately, it's the doctor's responsibility to make sure that patients understand things. So, I'm not going to put it on patients that, you're expected to ask these things. Mm-hmm. I do think it's good when people do their own research. I mean, I love it when I'm doing a consult and people are like, I have a list of questions. I'm like, oh, great. Well, let me, do my spiel and then anything I don't answer, I'm happy to answer. And a lot of times, because I've done things so many times, I usually will answer the questions. But it shows that people did their own research, they're involved with their care, and they're much more likely to get on the other side of things and have a good outcome.
For sure.
So, yeah, I thought that was pretty interesting, though. I've never heard anybody wish their plastic surgeon would die. I've heard people say, they're unhappy, but that's pretty intense.
Yeah, I wonder if she got the implants removed. Or
I don't know.
Still,
it's
like,
a good question.
around
Yeah, I wanted more information.
If she was that dissatisfied with them, I would think she would get them removed.
She very well may have. I mean, I don't know. That's an interesting question. I guess I could have dug up some pictures to see if it looks like she still has implants.
Yeah.
I mean, if she has any type of breast mount, she probably does. Although she could have had a tissue reconstruction. So,
Sure.
yeah, I don't know. It was pretty wild. I wanted to know more information for sure. I was trying to look up the doctor. And
I wonder if the rest of her interview was sour and spiteful though. I wonder if
because
she was
of
in
that,
a bad mood.
Brought up bad memories.
Yeah, if if she was just in a mood.
I think it was I think it was an interview for a magazine. It wasn't a live one, or I would have watched it. And now I can't remember what it was for. Maybe I wrote it down. No, man, I didn't write it down. It was an interview that she was doing. I forgot. But yeah, I thought that was pretty interesting that she's claiming this doctor just did something totally not what they had talked about. And that and it may have happened, or it just may have been bad communication. I mean, and interestingly enough,
when was the surgery done?
2001.
Yeah, nobody even heard about it. Did it make tabloids?
I didn't find any news about it. No, she probably kept it quiet. I mean, a lot of people don't want their bad experiences aired in public, the public forum.
Most people, yeah.
Most people.
Most celebrities.
So, but anyway, yeah, very interesting. I do think there are things to learn about this incident, and that is make sure you have a good doctor-patient relationship. It is important. You'll end up having better outcomes, and if your doctor is not willing to kind of meet you halfway and talk to you, then just find another doctor, period. I mean, there's lots of doctors out there, so find one that you're comfortable with.
Definitely.
Important stuff.
Yes.
Right, Sarah?
Yeah.
All right. Moving on to a more medical topic. There was a recent article talking about some of the biggest medical breakthroughs of 2023. You like my picture?
Yeah, it's AI, I'm guessing.
What? No, I drew that. Yeah, it's an AI pic. So I was actually pretty interested in this because it's very amazing how fast the speed of medicine works. I mean, now I've been in medicine so long that really a lot of time has transpired since I started, and I've seen some pretty amazing advances in things. Like the biggest one that pops in my mind is that, back when I was younger, one of the worst things that I feared was getting hepatitis C from an exposure of blood. Because I had this bad experience when I was a surgery intern where there was another surgeon that came in with hepatitis C and ended up dying. And we did a liver transplant, actually 2 on him, and then he ended up dying. And I was like, geez, man, I definitely don't want to get hepatitis C. And so that's something that in the back of my mind, because when you're a surgeon, you're exposed to blood and needles, and I mean, and needle sticks happen. I stick myself probably once a year.
Yeah.
Because I just throw so many sutures when I'm doing these big cases.
Yeah. And
it happens, and fortunately, most of the time all the times I've stuck myself, it's been with a solid needle. You don't want to get stuck with a hypodermic needle. That's the bad one. Okay. So nurses are more at risk for that because they're doing blood draws to get contaminated blood. I'm using needles for sewing, so they're solid. They're less likely to transmit. But anyway, I digress. They ended up coming up with a cure for hepatitis C, which was unbelievable. I was like, oh my gosh, that's crazy. It's like coming up with a cure for cancer. Not really, but something that was really a big problem that they found a cure for. So I was very interested in this article, and some of these things are a little bit esoteric, but I thought it'd be just interesting to know what are the big medical breakthroughs for 2023. So we're going to discuss.
Sure.
So have you guys heard of RSV?
Yes.
I know you have because you have kids. Travis, RSV, heard of that one?
Yeah, I have.
Yeah, respiratory syncytial virus. So most people think that is a disease of kids, or I kind of historically have thought that you always worry about your kids getting RSV. But actually there is a very high number of older adults, so over 65, that get RSV every year. And I didn't know this, it actually hospitalizes 60 to 120,000 elderly people every year.
Oh, kind of like pneumonia.
Yeah, it's actually the most common cause of lower respiratory tract infection. It's a viral pneumonia. I guess we'd call it walking. I've always called viral pneumonia walking pneumonia as opposed to bacterial, which does tend to be a little bit more aggressive. And there's 6,000 to 10,000 deaths a year from RSV in older patients. So they actually have come out with a vaccine for RSV, which is new. That's not something that I think.
Is it for adults?
Yes, it's for it's. I think it's targeted for older adults.
Okay, kind of like the shingles vaccine.
I mean, I'm sorry.
Kind of like when older people get the shingles vaccine.
Yeah, something like that. Yes, things that affect older adults more. So
Yeah.
I don't think they're trying to give it to kids, or that wasn't mentioned in the article. But yeah, pretty wild. RSV vaccine, something that's totally new. I don't know about the efficacy yet because it is kind of brand new. But that's something that's out there. If at least you can ask your doctor about if you or yourself or have family that are older. So next, this one's pretty interesting. They've come out with a new gene therapy for sickle cell disease.
Oh.
So sickle cell disease, for those that aren't familiar, is a genetic condition where your red blood cells go from a spherical to a more sickle or knife type shape. And that's not good. It tends to cause the blood vessels to get caught up or cause damage in the organs, and can cause a whole host of problems like stroke and kidney disease, blood clots in bad places. It's very common in African American community. Travis, you're familiar with sickle cell disease?
Yeah, I am.
So it affects 1 in 365 African Americans, which is a much higher number than the general population. It's a genetic thing.
Yeah.
So they have a new gene therapy for it, which is apparently very effective. It's something new that hasn't been out before, and there are a lot of people that suffer with sickle cell in the United States, and so anything that could potentially treat those patients, I think, is pretty interesting.
Absolutely.
Okay, here's an interesting one, Sarah. I want your thoughts on this, and I meant to ask my wife if she's. Cindy, if you're watching, let me know what you think about this next one. It's over-the-counter birth control pills. So historically, birth control has always been
prescribed
by prescription. And the reason for that is most birth controls, and my wife's probably going to yell at me because I messed this up. Most of them, I think, are estrogen progesterone combo, and I think the estrogen is what makes them a little bit more, I don't want to say dangerous, but more prone to have side effects. And so it's important that you talk to a doctor to go over, do you have risk factors that might aggravate these risk. Do you have risk factors that will aggravate the risk factors of the birth control pills? And so I think that's the main. But I've always heard, that there has been this push to do it over the counter just to increase accessibility, which I think is a good thing. So there's a new progestin-only mini pill. They call them mini pills because they only have progestin. That is now FDA approved for being over the counter. You can literally go pick it up at a pharmacy. Did you know about this? Is this like a thing that women know about?
I used to take it was like Lolo estrogen.
Okay.
Lolo estrin is what it was called, but it was because it was low estrogen.
Right.
Because I have naturally high blood pressure, and whenever I was birth control, if I take regular birth control, it gives me like even
worse.
More. Yeah.
Yeah, you have to be careful. I mean, there are some pretty severe side effects from some of those.
But now I don't take any of it because I think it's all not very great for your hormones in general.
Was that one that you took over the counter or prescription?
It was prescribed, but that was before.
Yeah.
I mean, I got that prescribed to me after I had Avery.
Gotcha. So, I mean, to my knowledge, this is the only one that's over the counter. I've been hearing that they were going to make birth control over the counter forever, and then there was some pushback from the doctors because, as you just said, there are risk factors associated with that. We all know that. And if for someone like yourself who has, a baseline blood pressure that's high, I mean, you definitely need to at least have a doctor check you out before you get it. But the mini pills, I think, are a little less likely to give you those issues.
Yeah.
So I think
aren't they coming out with like a male form of birth control or something?
I've heard that that's in the works, but I haven't seen it yet.
And like the main reason why they don't think it'll work is because they just don't think men will be
Men won't
consistent.
take it. They're not reliable.
They won't be able to take a pill every day.
Yeah, they'll forget.
Real quick, Robert Dreschel said, I'm not sure I trust OTC birth control pills. I'm not a doctor, but I play one on TV.
Okay, Robert. I appreciate that, buddy. I think that they're pretty effective. I don't think they would release it if it didn't work pretty well. Some of those, the oral contraceptives are 99% plus effective.
Yeah.
And I think that probably some of the ones that fail maybe just to how you take it if you miss a pill or something.
Yeah, you're supposed to take it at the exact same time every day.
So also for women, the next medical breakthrough, which I found very interesting, is they found a potential cause for morning sickness. So morning sickness in pregnancy is extremely common. 80% of women get it. It can be very severe to the point that it can, almost keep you bedbound. So they found a hormone called GDF15, which is produced by the fetus, and this hormone is what's been linked to causing morning sickness, because when that level of that particular hormone, GDF15, gets high in the mom's bloodstream, then they have morning sickness.
I never had it.
You never had it?
Mm-mm.
I was trying to remember if my wife had it. I don't think she had it bad. To my remembrance.
My sisters did.
Did they?
My oldest sister, for sure. It wasn't even like morning sickness. It was just like she would just get nauseous from anything.
And so what the article was also went into a little bit more detail, saying that some people are more sensitive to this particular hormone. So it's not just, is the fetus kicking out a lot of this hormone, but how sensitive are you to it?
Yeah.
That determine morning sickness. But the important thing is once you kind of find a cause for a problem, then it's a lot easier to make a cure.
Yeah.
Yeah, so they don't have a cure for it yet, but now that they know exactly what's causing it, that might be the next thing. Okay, this is another good one. This one's also going back to older adults. The first fully approved drug for Alzheimer's was released. Now,
I saw that.
I thought Aricept had been out for a while, but what it was saying is that the previous drugs had ended up failing clinical trials. So I probably should have actually looked at that, because I remember Aricept has been out a while. I don't know, have you heard of that one, Aricept? It's just a drug that a lot of people that have Alzheimer's take. But since I don't really treat Alzheimer's, I wasn't really clear on how well it worked. I didn't think it was a miracle cure drug from just my basic knowledge of it.
When did that drug that you're talking about come out?
It's been out a long time, like 10 or 15 years at least.
Oh.
Yeah.
It runs in my family, so.
Alzheimer's does. So there's a new drug out called Leqembi, Leqembi, and it has been shown in clinical trials to slow cognitive decline associated with Alzheimer's, and it does it by targeting the amyloid beta plaque. So Alzheimer's disease is a result of this plaque buildup in the brain, which starts to affect how the circuits run and how the messages are transferred from different areas of your brain, which affects cognition. And this drug attacks those plaques that are the cause of Alzheimer's. And it apparently is fairly effective. It didn't give any hard numbers, but they were very positive on it. And it's just received FDA approval. And so I assume that we'll be hearing of people.
Yeah, so do you get it prescribed if you've been diagnosed, or is it more of a preventative?
No, I think it's not a preventative. Well, I don't know, maybe if, that's a good question.
I know it's a hereditary.
It is.
Most of the time.
Yeah.
And so it's I wonder
if you take it preemptively?
Yeah.
That's a good question. I'll ask some of my medical doctor friends if they know the answer to that. I mean, I could probably do a Google search, but probably better to ask a doctor.
Yeah.
I don't really treat Alzheimer's being a surgeon, especially a plastic surgeon. I have basic knowledge of it. I remember the amyloid beta plaques as the cause. But yeah, this new drug, Leqembi, Leqembi, first fully approved drug by the FDA. Probably, I bet Aricept was maybe partially approved, or it had some green light, but they were like, it may or may not work.
To add to that, I saw an article about how diabetes is linked to dementia and Alzheimer's.
Diabetes linked to so much.
Yeah, because they've discovered that it's like an insulin situation as well. So I thought that was interesting, because that also runs in my family. So I'm like,
make sure you go to the doctor regularly.
Yeah.
Good for you.
I don't have diabetes, but.
It's good to just keep on top of things, just to make sure that nothing's popping up.
Yeah.
Okay, as a surgeon, the next one is super interesting to me. So one of the worst cancers out there that you can get, absolute worst, is pancreatic cancer.
Yes.
The 5-year survival rate. So 5-year survival rate is a very common gauge of how dangerous a cancer is. And basically it's a number that says, okay, 5 years after diagnosis, what % of patients are still going to be alive? And so for something like stage 1 breast cancer, it's 98%, which is really high, right? 98% of people are still alive. As the stages get worse, then that number starts to drop. But the overall 5-year mortality rate, or 5-year survival rate, the 5-year survival rate for pancreatic cancer is 10%. It's terrible. It means 90% of people get a pancreatic cancer diagnosis, will be dead within 5 years.
Yeah.
It's crazy high. I remember doing a lot of endocrine surgery when I was in general surgery and surgical oncology. And I didn't like pancreatic cancer because I just felt so bad for the patients. It was just very kind of sudden. It's a very ominous cancer. It pops up, and usually by the time it's diagnosed, it's really advanced.
Yeah, that's what I was gonna say.
Yeah.
By the time you know that it's there,
yeah, it's really bad.
too late.
And the pancreas is right there by some super critical structures. So once it starts spreading, I mean, it's problematic very,
Yeah.
very quickly. So there's actually a new vaccine for pancreatic cancer, which is kind of the new thing where they're getting vaccines to not only prevent but treat cancer. So this vaccine triggers T cells to actually attack the cancer cells. Now, the thing about this vaccine is it didn't work for everyone. So in the trial, I want to say about half the people had a really, really good response. But what was amazing is in the people that got that big T cell response, it actually cleared the cancer to where they couldn't detect it like a year or two later.
Oh.
That is unbelievable. I mean, a lot of people...
So it saved people?
Yes, yeah.
Nice.
That's what they're saying. Now the trial is pretty small, so it's not this really big landmark trial. But the initial data was very, very encouraging to me. And to be fair, pancreatic cancer is not super common. I mean, it's not like breast cancer, lung cancer, colon cancer, where the numbers are really high.
Yeah.
But like I said, what made it really, really bad is just it's very, very aggressive. It's very common that it's pretty far advanced when it's diagnosed, and it's just there's not great treatments for it. But this is very encouraging. So yeah, I found that interesting. Finally, coming back to the very beginning of the segment, AI.
Okay.
AI programs boosted cancer detection for breast cancer. So there was this program developed by the Brits. It had a name like Lucy or Mia, I can't remember now. It had a name, and it was a AI program that looked at screening breast radiographs.
Okay.
And compared to humans, it picked up 13% more early breast cancers than the radiologist did. Our jobs are getting replaced already.
Oh my gosh.
It's going to happen to everyone. AI is going to replace us. So, I mean, that is interesting in that, AI is being used to, I guess, augment human detection. I don't think AI will ever replace, human, like a radiologist. I don't think that's going to happen, but I bet it'll be like a safeguard. The human will read it, then the AI reads it, and then you make sure that they coincide.
Yeah, for anything involving AI, I feel like you have to go back because AI will just make stuff up.
Yeah, I have seen that before. It's fine. AI occasionally will do that, and I've actually
if you ask it to write a book report about you. If it needs something to add something, it'll be like,
blanks.
Did you know he was an astronaut? Or astronaut. It'll just put something in there. And
I've had to do that before. I've actually had AI make some pretty silly mistakes, and if you correct it, it'll be kind of embarrassed. It's like, oh, I'm so sorry, you're right. So you do have to check AI. I mean, I'm a big fan of it, as you guys know. I use it all the time. In fact, I used it for the segment we're doing. I mean, not for the body of it, but for the opening photo.
Yeah.
You do got to kind of keep an eye on it.
Yeah.
It has a tendency to go rogue sometimes.
Yeah. Speaking of that, did you see I don't know if it was from today or yesterday, but President Putin said that he has a vaccine for cancer.
Oh, he does? That's like a real thing, or?
Yeah, it was I saw a post about it.
Really?
Yeah.
I did not see that. I will absolutely go look that up.
Doesn't he say stuff like that all the time? Like he's like, we got this, and then you're like, okay, and then it never. And
then it never shows.
Yeah.
I don't know. Maybe I don't know a whole lot about Putin. I did watch that interview that he did with Tucker Carlson.
Yeah.
It was very long and a lot of history. I actually watched the whole thing just because I was just interested to see.
I watched the recap of him trying to figure out what exactly happened. He was just like, I don't know that he ever actually answered one of my questions.
Tucker Carlson asked a question, and it was like a 40-minute answer.
Yeah.
Going through the history of Russia.
Yeah.
But I'll have to look up the Putin cancer vaccine.
Yeah, I think I saw it on BBC, their little Instagram thing.
All right, I'll take a look and see if that's a real thing. Yeah. So, all right, you guys, that's all the time we have today. Thank you guys so much for watching. Please hit that like and subscribe button. Leave us a comment. Can't wait to see you next week here on Nip Talk.